All consultants have been asked to conduct clinical validation on our waiting lists by Manx Care. This means we've been asked to review all of the patients and referrals on our waiting lists to check if they are still required, necessary or appropriate, with the hope to reduce some of the waiting times. This is something I'm going to do every 6 months. Reviewing the waiting lists means scrutinizing every patient's referral, looking at the pathways and tests that they need, and doing things like ordering investigations like lung function tests ahead of them being seen by a consultant. We will also look to see if they've had any hospital admissions or GP updates since their original referral. By doing this, we've picked up some cases that needed more urgent action and some that had already been discharged on another pathway. For the respiratory clinic, I have reviewed nearly 800 patients, 238 of whom were waiting for a routine follow-up, and 574 new patients on a list which went back to 2019. Currently, we have a 4-year waiting list for routine follow-up appointments and new patients, and this doesn't cover urgent follow-up appointments or urgent new patients, for which the waiting list is currently 12 months. Once I have done the clinical validation on these appointments, we hope to reduce this waiting time to 6 months. Once reviewed, patients will either receive an update letter, some direct advice or guidance, or a discharge letter. If a patient is discharged but still has concerns, they are asked to contact their GP for another assessment to ensure that the referral to my clinic is still the right pathway. In many cases, the symptoms that prompted the referral will have resolved.